Now, let's go to another topic and probably our last discussion for legal medicine. Okay? So, like I've said, our discussions or lectures are just mere overview of the book, okay, of Pedro Solis. And other part of the lectures are taken from the internet because, like I've said, the book of Pedro Solis is an old book. So some of its discussions are outdated, okay? So refer to your book, and then for further reading, research in the internet regarding the topics, okay? So our last topic is about alcoholism and poisoning. So what is a poison? A poison is anything other than physical agencies which is capable of destroying life, either by chemical action on the tissue of the living body or by physiological action by absorption into the living system. Okay? So, in other words, poison is a chemical reaction towards the body. Okay? Anything that affects the physiological condition of the body, okay, is considered a poison. So legally, a poison is a substance which, if applied or administered internally, has been applied or administered with the intention to kill or to do harm. Okay? So in law, if you use poison, okay, to harm another person, okay, your action is with intent to kill. So if a crime will be filed towards you, so it's either murder, okay, because with intent to kill, and the use of poison qualifies the crime to murder, okay. So the quantity does not affect culpability, nor is the law concerned with the quantity in which the substance acts. The gastrointestinal tract is only one of the means of entry of poison into the body. Okay? So meaning, poison can be entered in other parts of the body. For example, injection. Okay? And in this scenario, the person uses poison through the gastrointestinal tract. Okay? For example, the killer placed a poison in the food of the victim. Analysis of the gastric content would not eliminate poisoning as a factor when poison gains entrance into the body via other route. Even if the poison was taken orally, after a significant period of time has elapsed from ingestion to death, the poison might have passed out of the stomach and could no longer be present in identifiable amount. Okay? So, if you are the medical legal investigator, you must take into consideration, okay, the entirety of the case. So, if it doesn't mean if the content of the food, I mean the content of the stomach, like foods, okay, poison can't be found. It doesn't mean the person was not killed due to poison. Okay? So you must examine everything in its entirety. If analysis of the gastric contents disclosed presence of possible toxic substance, it is possible that the said poison could have been introduced postmortem to conceal the real cause of death. Site of action of poison. Local action. The poison may act on the skin or on the mucous membrane or on any part of the body where it is applied. Example, sulfuric acid. Okay? Next is remote action. The poison may act remotely in any of the following ways. First, by the production of shock. Example, poisoning by strong acid. Second, by absorption into the blood and being carried to the organs they affect. Example, morphine is absorbed by the blood and carried to the brain and depresses it. Third, by transmission through the nerves of local parts affected going to the nerve centers and then reflected to the organs on which they act. Now, let's go to the site of remote actions of different poisons. Okay? If on the brain, use of narcotics, alcohols, cerebral stimulants like caffeine. On the spinal cord, use of strychnine. On the peripheral nerves, conium or curare. On the alimentary tract, the use of corrosives. Okay? It affects the alimentary tract. On the kidneys, the use of cantharides. Okay? On the salivary glands, the use of mercury. On the liver, phosphorus. On the mucous membrane, arsenic. On the heart, the use of digitalis. Okay? On the blood vessels, the use of ergot nitrites. On the blood cells, snake venom. Okay? So, these types of poison affects those part of the body. Both local and remote. The poison may act at the site of application and in some distant place. Example, carbolic acid is an irritant to the alimentary tract and also toxic when absorbed. Okay? Like in the case of embalming, okay? Like in the case of putrefaction. So, general symptoms of poisoning. So, it can include feeling and being sick, diarrhea, stomach pain, okay, if you ingest food with poison or chemicals, drowsiness, dizziness or weakness, high temperature like 38 degrees Celsius and above, chills or shivering, loss of appetite, headache, irritability, difficulty swallowing or dysphagia. There is difficulty in breathing, producing more saliva than normal. Okay? The person salivates. Skin rash, blue lips and skin discoloration. Okay? Cyanosis or the bluish discoloration of the lips and skin. Burns around the nose or mouth. Double vision or blurred vision. Mental confusion. Seizures or fits. Loss of consciousness. And coma in severe cases. Now, if you are the doctor or if you are the medical legal officer or the physician, okay, like in the emergency room, how is poison diagnosed? A combination of history, physical examination, and laboratory studies will help reveal the cause of most poisonings, okay? So, frequently, treatment must begin before all information is available. Okay? You must treat the patient first. For example, you use gastric lavage. Okay? Or if chemical, you use other medical treatment for that kind of poison. Next, taking history for differential diagnosis. As a family member or friend of a poisoned person, you can greatly assist the doctor and provide valuable clues by telling the doctor about these details. First, everything the person ate or drank recently. Then, the names of all prescription and over-the-counter medications the person is taking. Next, exposure to chemicals at home or at work. Next, whether others in the family or at work have been similarly ill or exposed. Next, whether the person has any psychiatric history to suggest an intentional ingestion or a suicide attempt. So, different diagnosis. A specific blood test will give serum levels of some drugs, including phenytoin or dilantin, theophylline or Theodore, Rispid, Slowbid, Theo24, Theolair, Unifil, Slofilin, digoxin or lanoxin, lithium lithobid, and acetaminophen. Okay? So if you use the blood test of a person, these chemicals, okay, the serum levels of these drugs can be found. Okay, some drugs affect the electrical activity of the heart. An electrocardiogram or ECG may reveal toxicity. Sometimes a person is unconscious for no obvious reason. So a CT scan of the brain will help tell if there has been a structural change in the brain, such as a stroke. Now, helping someone who is poisoned but conscious. So if you think someone has been severely poisoned and they're still conscious, ask them to sit still and stay with them while you wait for medical help to arrive. So if they've been poisoned by swallowing something, try to get them to spit out anything that is remaining in their mouth. Okay? So you tell them to spit anything that is in their mouth. So if a harmful substance has splashed into their skin or clothes, remove any contaminated items and wash the affected area thoroughly with warm or cool water. Be careful not to contaminate yourself in the process. So, helping someone who is unconscious, okay, a person who was poisoned and is now unconscious. So, if you think someone has swallowed poison and they appear to be unconscious, try to wake them and encourage them to spit out anything left in their mouth. Don't put your hand into their mouth and don't try to make them sick, okay? So, while you're waiting for the medical help to arrive, lie the person on their side with a cushion behind their back and their upper leg pulled slightly forward so they don't fall on their face or roll backwards. This is known as the recovery position. And then, wipe any vomit away from their mouth and keep their head pointing down to allow any vomit to escape without them breathing it or swallowing it. Don't give them anything to eat or drink. If the person isn't breathing or their heart has stopped, begin cardiopulmonary resuscitation or CPR if you know how to do it. Okay? Hospital treatment. Okay? How do you manage poisoning? Okay? First, activated charcoal. Sometimes used to treat someone who's been poisoned. The charcoal binds to the poison and stops it from being absorbed into the bloodstream. Okay? Antidotes. These are substances that either prevent the poison from working or reverses its effects. Sedatives may be given if the person is agitated. Ventilator or breathing machine may be used if the person stops breathing. Anti-epileptic medicine may be used if the person has seizures or fits. Medical evidences. So, in a court proceeding, in a trial of a case of poisoning, the defense lawyer will prove that the death of the victim was not due to poisoning but to some natural causes. Okay? That the victim did not suffer from poisoning of the particular poison mentioned in the complaint or the information. That there was no intent on the part of the defendant to poison the victim. Okay? So if you are the defense lawyer of the perpetrator, you must disprove all the prosecution's evidence. Okay? You must give your own evidence in order to disprove the prosecution. History and symptoms during life. History of any previous suicidal attempts. History of his mental condition. History of business, marital, and social failures. Presence of persons having a grudge against him. Possible source of poison. Time of the actual administration of the poison. Nature and actual time of occurrence of the symptoms. Order of the occurrence of the symptoms. If the victim died, Note the exact time of death and the period of time from ingestion to death. Inquire about the presence of vomitus, urine, and other bodily discharges for analysis. The date, time, and place where the victim was last seen alive. Okay? So, if you are the defense attorney, the defense lawyer of the alleged killer or alleged perpetrator, okay, you must study the case in its entirety and take note of these instances, okay, in order to disprove the theory of the prosecution. Now, if you are the medical legal officer, you must take note of the following: postmortem examination, external postmortem examination. Note the attitude of the body and the dress, especially for stains. External signs of physical violence, the expression of the face, because some poison with convulsion as the symptom may be inferred from the expression of the face, and then the approximation of the time of death. Okay? Then, the internal post-mortem examination. The bodily openings must be noted for any peculiar smell, characteristic of some poisons. Example, carbolic acid, hydrocyanic acid, phosphorus, chloroform, etc. Okay? These types of poison has a peculiar smell. So, as a medical legal officer, you must take note of these scents. Next, the tongue, mouth, and esophagus must be examined for inflammation, erosions, and staining. Then the larynx, trachea, and bronchi must be opened to see the effect of volatile irritants. So, in a post-mortem examination, if you are the medical legal investigator, you should test the following poison, okay, and the corresponding body organs that is required. You get the sample, okay. For arsenic, for acute poisoning, the organs required is the liver, kidneys, stomach contents. If arsenic for chronic poisoning, you can examine the hair, the urine, the liver. For mercury, the liver, kidneys, stomach, and intestines. For phenol, the liver, kidneys, and stomach. For alcohol, the blood, the liver, kidneys, urine, and the brain. For cyanide poisoning, the stomach and liver. For phosphorus, stomach, liver, kidneys. For carbon monoxide, blood, okay, blood serum, placed in a sealed container. For veronal, luminal, and amital, use urine, brain, liver, and kidneys for samples. For strychnine, stomach, stomach contents, liver, kidneys, and urine. For morphine, stomach and its contents, liver, and urine. For other alkaloids, stomach and its contents, liver, and urine. For lead poisoning, for chronic lead poisoning, the bone, the kidneys, the liver. For mineral acids, the stomach and its contents, the esophagus. For oxalic acids, stomach and its content, the liver and urine. Now, the chemical analysis. This portion of criminal investigation is beyond the scope of a physician's duty, okay? Because at this point in time, it requires a specialized skill, an expert, okay, a medical legal expert. The expert analyst or a toxicologist is much more in the position to perform the work. The expert chemist, analyst, or toxicologist must be able to answer the following questions. A. When, where, and from whom did you receive the article which you have analyzed? B. In what state were they received? C. When did you analyze it and where? D. Did you analyze it alone or were you assisted? E. What test did you employ? Now, let's go to classification of poisons, okay? Poisons may be classified on the basis of its effect on the body or purely from a chemical standpoint. So, broadly based on the effect like corrosives, irritants, narcotics, depressants, excitomotor inaction, irrespirable gases, contact poisons, vulnerants. Okay? In the other hand, in its chemical standpoint, is it gaseous, inorganic, organic, or miscellaneous? Okay? Examples, corrosives like strong acids. For example, sulfuric acid, nitric acid, okay? Carbolic acid, and so on and so forth. Then, caustic alkalis like ammonia, compounds like antimony, irritants, if non-metals, salts of metals, vegetable irritants like castor oil, belladonna, digitalis, and etc. Animal irritants like cantharides, and then food irritants. Next is narcotic like somniferous group like opium, chloral, synthetic hypnotics, and then deliriants like belladonna, stamonium, hyoscyamus, and cocaine. Depressants like neural depressant, paralysis of the spinal cord, for example, aconite, conium. And then cerebral depressants, the effect is inhibiting the brain functions like hydrogen cyanide, laurel water, oil of bitter almond. And then cardiac depressants like digitalis, camphor, strophanthus. Next is excitomotor inaction like strychnine, brucine, and thebaine. And then irrespirable gases like poisonous gases, okay? Like carbon disulfide and so on. And then irrespirable gases like benzene. And then contact poisons like vegetable, animal, and chemical irritants. And then vulnerants like nails, broken glass, and dust. From a chemical standpoint, gaseous poisons, okay? For example, hydrocarbons, war gases. Another group is inorganic poisons like corrosives, characterized by an intense and destructive action like acid, mineral, okay? And then alkaline corrosive, okay? And then halogens, then corrosive metallic salts, and then organic corrosives like phenol. On the other hand, metallic poisons and salts like protoplasmic irritants absorbed into the systems. And then heavy metals like antimony, arsenic, and etc. And then inorganic salts like lithium salts and etc. Okay? Those are examples of classification of poison in a chemical standpoint. And then let's go to organic poisons. Volatile poisons, the chief action post-absorption. Allopathic compounds like amyl alcohol, dimethyl carbinol, and acetaldehyde, and etc. And then the atomic compounds like benzene series and essential oils. And then alkaloidal poisons, toxic actions on the central nervous system. Volatile like nicotine and quinine. Non-volatile, opium, aconitin, physostigmine, and etc. And then another classification, non-alkaloidal like hypnotics, example, allopathic and aromatic. And then in the aromatic, dinitrophenol and atofan and etc. And then next is the glucosides like strophanthus, gossypium, cilia, cannabis, indica. And then next, organic purgatives like jalap and anthracene. Next, classification, essential oils like abortificants, apios, and afyon. And then picrotoxin group, water of the hemlock. And then the miscellaneous group, taxus, abrios, and laborum. Okay? So, some of these topics are discussed in your pharmacology class. Okay? For more information, please refer to the book And for other important updates, okay, I will give you points for research, okay? Miscellaneous poisons associated with botulism, food poisoning, mushroom poisoning, snake venom poisoning, abnormal hypersensitivity to normal constituents of food, poisonous animals and their poisons like arachnids, centipedes, insects, caterpillars, vertebrates, and etc. And then ground glass. Now, let's go to food poisoning. Okay, what is food poisoning? It is a state of ill health resulting from food which has some abnormal or noxious content. Food may cause disease in the following ways. First, lack or excess. Okay, if you do not feed yourself, okay, or if you are gluttonous, you overly feed yourself, okay, it can cause a disease. Next, unbalanced proportion of proper constituents. Third, absence of certain constituents including vitamins and specific protein, okay? The food has no nutrients, okay? Fourth, idiosyncrasy. The most common reaction occurs in the gastrointestinal tract in the form of nausea and vomiting. The sensitivity may be manifested in the form of rashes, okay? Fifth, presence of abnormal constituents like products of putrefactive bacteria, specific bacteria, okay? The food is dirty and has these elements. Parasites, molds, vegetable substances as ergot in rye or solanine in potatoes, chemicals. 6. Food inherently poisonous as fungi, horseradish, water hemlock. Next, bacterial food poisoning. Okay? Food poisoning of non-specific bacterial origin. This is sometimes called tomaine poisoning and is probably caused by the degradation products of the protein molecules occurring in the decomposition of food when they have reached an advanced stage. Okay? So, when the food is not eaten for a long period of time. Okay? Specific bacterial food poisoning. This is brought about by infection with the Salmonella group of microorganisms. So, what are the symptoms of food poisoning? Okay? First, vomiting and diarrhea, and then abdominal pain, prostration, collapse with a cold sweating, rigor with pain at the back and limbs, headaches, and dizziness. Now, if you are the medical legal examiner, you should take note of the following postmortem examination in order to determine the origin of the poisoning, okay? So, for food poisoning, the following are determined. First, congestion of mucous membrane of the stomach and intestine, petechial hemorrhages of the visceral organs, cloudy swelling of the kidneys, congestion of the liver and spleen, and then isolation of the specific organism. Okay? Now, let's go to bacteriology. The members of the Salmonella group, which may cause food poisoning, are bacterial enteritidis, bacterial paratyphosus A, bacterial paratyphosus B, bacterial airtrike, bacterial swipistifer, bacterial psittacosis, and then bacterial abortus equi. Okay? These are the following bacteria associated with food poisoning. Okay, now let's go to botulism. What is botulism? This is a specific infection in which symptoms arises from the ingestion of a very potent exotoxin of anaerobic Clostridium botulinum. Okay? These are toxins which are in foods that were prepared using unsanitary utensils, okay? Dirty hands, okay? And so on and so forth. Poisoning is usually due to ingestion of food stored and prepared in unsatisfactory conditions and eaten without cooking. Okay. These are also foods which are raw. Okay. So there is a toxin present, a bacteria, Clostridium botulinum, and due to this bacteria, this results to food poisoning. Now, let's go to the postmortem findings in some chemical poisoning. Okay? So, first is sulfuric acid. External appearances are putrefaction is frequently delayed. There are cutaneous stains in areas where the corrosive liquid has been spilled. The stains are frequently found in the angles of the mouth and running in a linear fashion from the posterior part of the lips to the chin. The outer layer of the skin are destroyed. The tongue and mucous membrane of the mouth may be softened, corroded, and white in color. Internal appearance. Cardiovascular system. The aorta may be found with the outer wall blackened and corroded. The blood in the vessels may be coagulated and hardened. Respiratory system. The epiglottis may be blackened and shrunken. The mucous membrane of the larynx and trachea may be swollen and congested. Death may be due to asphyxia when acid has been inspired or ingested. Next is hydrochloric acid. External appearance. External staining is absent. The angle of the mouth may be whitish, opaque, and may be inflamed. Internal appearance. Blood is darkened but not as a rule coagulated by the action of acids. Edema of the glottis is present. There may be congestion and edema of the lungs. Esophagus is dilated with mucous membrane reddened and inflamed. The liver is pale and fatty. Okay? Next is nitric acid. The lesions produced by nitric acid are similar to hydrochloric acid, except that the cutaneous stains are distinctly. Another classification is caustic alkalis, or for example, potassium hydroxide, sodium hydroxide. Okay? So, if you are the medical legal investigator, you should take note of the following appearances. External appearance, dirty yellow color stains at the angle of the mouth and on the chin. Swelling of the tissues in contact with the alkali. Surface of the tongue, mouth, and lips becomes slightly reddened or dark. Okay? Internal appearance. Pharynx is lined by softened and hyperemic mucous membrane. Edema may be considerable, especially at the opening of the larynx. Peritoneal surface is pale, and blood vessels are filled with dark fluid blood. The wall of the stomach is edematous and with a soapy feel. Next is ammonia. Example, ammonium hydroxide. The appearances are external appearance. Lips, mouth, pharynx, and larynx are inflamed with patchy erosion of the mucous membrane. Internal appearance, digestive system. The tongue is swelling with the mucous membrane softened and peeled off. The mucous membrane of the esophagus and the lower portion may be detached and it is intensely inflamed. Another group, phenol and its derivatives like lysol, cresol, carbolic acid, and etc. Appearances. External appearance. Brownish and shrunken stains at the angles of the mouth, chin, and cheeks. Characteristic odor of phenol is perceptible. Okay? Internal appearance. The blood is dark and fluid. The lungs are congested and sometimes edematous. If the victim lived for some time, bronchopneumonia may be found. There may be edema of the glottis and of the vocal cord. Digestive system. The tongue is swollen with white fur and the mucous membrane is hardened. The esophagus is contracted and the mucous membrane is thrown into the ridges.
It is grayish-white in color, and longitudinal fissures running between the ridges are hyperemic. The urinary bladder contains greenish, smoky urine. Okay? So, like I've said before, these are just matters of reading. Please refer to your book. Okay? For example, in our discussion, these are enumerations, definitions of terms. Okay? So, refer to your book for further discussion. Next is acute arsenic poisoning. Appearances. External appearance. The whole body may have a shrunken appearance. The cutaneous surfaces, especially the hands and feet, are cyanotic or there is bluish discoloration. Putrefaction of the body is quite delayed. Internal appearance, cardiovascular system. Heart contains coagulated blood. Ecchymosis is frequently observed underneath the pericardium. Respiratory system. The lungs are congested and sometimes edematous. Subpleural hemorrhage may be present. Digestive system. Changes in the mouth, pharynx, and esophagus are rare. If death is delayed, there may be inflammatory changes in the duodenum. The solitary and Peyer's patches are swollen. Okay? Another classification of poison, mercury. Okay? Example, perchloride and nitrate salts. Appearances. External appearance. If the salts, perchloride or nitrate of mercury has been taken by mouth, it produces corrosion of the epithelium and swelling of the lips. Okay? Internal appearance, digestive system. The mucous membrane of the mouth is softened, whitish, and sodden looking. The esophageal mucosa is corroded, softened, and inflamed in patches. Okay? So, if you are the medical legal investigator, you should take note of the signs of this type of poisons. Next, lead in chronic poisoning. Appearances. External appearance. Emaciation. Parotid gland are sometimes enlarged. Wasting of the muscles of the shoulder, arm, and forearm. Internal appearances. Blood is thin and watery. Cardiovascular system. Fibrosis of the myocardium. Interior of both articles and ventricles is whitish and opaque in appearance. Digestive systems. Teeth are discolored and brown. Intestine is inflamed, contracted, and thickened. Patches of pigmentation may be present in the mucous membrane of the large intestine. In the renal system, kidneys resemble that of arteriosclerosis. They are smaller than their normal size. The surface is granular. Another type of poison is phosphorus, like rat poison, fireworks, matchstick, and etc. Okay? Appearances, cardiovascular system. Heart is flabby and the musculature is pale, friable, and fatty. The blood is dark and fluid. Respiratory system. Blood-stained fluid may be effused into the pleural cavity. The lungs are congested. There may be subpleural hemorrhages. Digestive system. The stomach may show swollen grayish-white mucosa. The intestine may also show the same changes as that of the stomach. The liver may be enlarged, soft, and doughy. There may be small hemorrhages in the omentum. Another type, hydrocyanic acid. Example, potassium and sodium cyanide. Okay? Appearances, external appearance, rigor mortis sets in early and persists longer than usual. Cyanosis of the skin may be present due to asphyxia. Mouth and nostrils may show froth. Okay? Internal appearance. Characteristic odor is emitted on opening of the abdomen. Blood is bright red in color and coagulated. Cardiovascular system. Right side of the heart is distended with blood. Left ventricle is contracted and empty. Venous system is engorged with blood. Pericardium may show petechial hemorrhages. Respiratory system. Larynx and trachea contains blood-tinged froth. Lungs are congested and edematous. Odor of bitter almond is perceptible. Subpleural petechial hemorrhages. Now, let's move on to alcoholism. Introduction and classification. Ethyl alcohol or ethanol, grain alcohol, it is a colorless, transparent, volatile liquid with aromatic odor and with boiling point at 78 degrees Celsius. Like any other types of alcohol, it is formed out of the fermentation of various carbohydrates in grains, fruits, or flowers, and from other materials subjected to and isolated by distillation. Okay? Ethyl alcohol is commonly used as solvents, antiseptic, and beverage. When ingested, it does not require digestion before absorption. Although the word alcohol refers to a large group of chemical compounds in possession of hydroxyl radical. Whenever alcohol is used as part of a beverage, it refers to ethyl alcohol. Okay? A drunkard is a person who habitually takes or uses any intoxicating alcoholic liquor, and while under the influence of such, or in consequence of the effect thereof, is either dangerous to himself and to others, or is a cause of harm or serious annoyance to his family or his affair or ordinary proper conduct. Okay? In law, the use of alcohol can be an aggravating circumstance or mitigating circumstance. Okay? By aggravating, it means that the crime is penalized in a much higher degree. Okay? Due to the aggravating circumstance of the use of alcohol. By mitigating, it means the crime is penalized in a lesser degree. And again, due to the mitigating circumstance of alcohol ingestion. Classification of commercially available alcoholic beverages. Okay? Wine, a product of natural alcoholic fermentation with wide variety of sugary materials, including fruit juices, and contains not less than 7%, but not more than 17% of alcohol by volume. So, in fermented beverages, the alcohol content is expressed in volume percent. Okay? Red wine. The wine contains extracted pigments from the skin, stem, and seed of the fermented fruit juice. The color ranges from pale straw to pale pink. Okay? White wine. The product of fermentation of fruit juices only after removal of the skin and stem. They are not really colorless, but impart a pale straw or green to gold or amber color. Dry wine. Wine wherein practically all the sugar contents are fermented into alcohol. Sweet wine. Wine which contains not less than 1 gram of sugar per 100 milliliter. Still wine. Wine in which fermentation has been completed before bottling so that it contains only such properties of carbon dioxide. So, continuation of still wine produced in the fermentation which can be dissolved in the liquid in equilibrium with air under conditions of manipulation. Okay? Next is distilled liquor. Distilled liquors are alcoholic beverages produced from distillate of wines, distilled from grains or starch solution, or distillate from aromatic substances. In distilled beverages, the alcohol contents are expressed in proofs. Okay? Proof is approximately twice the percentage of alcohol by volume. Okay? So, whiskey, an alcoholic distillate from mass of cereal grains or cereal grain products, such as saccharide, by the action of yeast distilled at less than 74.7 degrees Celsius, in age at least 3 years, and may contain a flavoring of caramel. Next is gin, the distilled product obtained from the original distillation of mash or by redistillation of distilled spirits with or over juniper berries, and may contain other aromatic botanical substances or sugar. Next is rum, a distilled alcoholic beverage prepared by fermentation, distillation, and aging of sugar cane products. Okay? Example is sugarcane juice and molasses. It is a yellow-brown liquor of fine, bouquet, and sweet, smooth, alcoholic taste. It may contain caramel. Next is malt liquors, alcoholic beverages brewed from the malt or from a mixture of malt and malt substitute, like rye, and may contain other cereal grains and starchy saccharine matters. A characteristic bitter flavor is imparted by the addition of hops. Next is ale, a malt liquor brewed in such a manner as to possess the aroma, taste, and character commonly attributed to ale, and shall contain not less than 3.2% absolute alcohol. In its fermentation, top yeast are utilized instead of bottom yeast, the latter being utilized in beer. Okay? Next is beer, the product of alcoholic fermentation of a mash in potable water of the malted barley, hop, and or hop preparation with or without the addition of starchy and saccharine material, and shall contain not less than 2% and not more than 10% by volume of alcohol. An alcoholic beverage shall possess the characteristics attributed to the type of drink that is stated in the definition and standard of identification. The preparation must be free from any ingredients injurious to health, free from the sediment of any kind, and shall be manufactured in premises built and maintained under hygienic conditions. Okay? Now, let's go to the causes of drinking alcoholic beverages. First, curiosity. Okay? Children tends to explore. They are curious. Okay? Children prefer to experience the pleasant and unpleasant effects rather than being told. Okay? Especially when a child gets rebellious. Okay? He tends to drink alcoholic beverages. Okay? Doesn't listen to parents, okay, to teachers, and so on and so forth. It is being served as a symbol of friendship and sociability. Social gathering with alcoholic beverages served becomes lively. Drinking is a part of our culture. Okay, in Philippine setting, especially when there are gatherings, of course, alcoholic beverage is always present. It is part of our social lifestyle, okay? When friends gather or even when a group gathers, okay? Alcoholic beverage is always present. It is also an escape from unpleasant realities. It suppresses inner tension, lessens the pain of failure, frustration, and anxieties. Alcohol is a part of religious ceremonies, okay? Especially in the Catholic, where the priest, okay, drinks the wine, which is considered the blood as a symbolic sign, okay. Then, as a stimulant to combat shyness, inferiorities, and to suppress strong inhibition, okay. For example, if you want to court someone and you're very shy, of course, you drink alcoholic beverage in order to push yourself, okay, to forget everything and just go for it. And then, it is a source of heat and energy. 1 gram of alcohol may yield calories by the process of oxidation. 1 ounce of 100 proof whiskey may yield 100 calories. Provisions of law regarding alcoholism, okay? So, intoxication is an alternative circumstance to criminal liability. Okay, like what I said earlier, it can be an aggravating circumstance or a mitigating circumstance. Okay, depending on the situation. Okay, under Article 15 of the Revised Penal Code, alternative circumstances are those which must be taken into consideration as aggravating or mitigating according to the nature and effects of the crime and the other conditions attending its commission. They are the relationship, intoxication, and the degree of instruction and education of the offenders. Okay? So, these are the alternative circumstances. One of these is intoxication, in which we are discussing right now. So, for example, if you use alcoholic beverage in order to perpetrate a crime, then it is a aggravating circumstance. Okay? It increases the penalty. However, if you committed a crime because you were drunk, you can use it as an mitigating circumstance. It decreases the penalty because you were not aware. You were drunk. Okay? So, intoxication is taken into consideration as a mitigating circumstance when the offender has committed a felony in a state of intoxication. If not, and the intoxication is habitual or intentional, it shall be considered as an aggravating circumstance. Okay? So, mitigating, if intoxication is not habitual or if intoxication is not subsequent to the plan to commit the felony. Now, let's discuss intoxication as an aggravating circumstance. Okay? So, it is aggravating if intoxication is habitual or if intoxication is subsequent to the plan to commit the crime. Okay? So, when you use alcoholic beverage in order to perpetrate a crime, then it is an aggravating circumstance. The penalty is increased. Okay? Example, public scandal committed by a person while drunk is punishable. To be drunk is not punishable, but if alarm and scandal happens in a public place while at the state of intoxication, it is punishable. Okay? Article 155 of the Revised Penal Code provides that alarms and scandals, the penalty of arresto minor or fine not exceeding 200 pesos may be imposed upon any person who, while intoxicated or otherwise, shall cause any disturbance or scandal in public places. And then, contracts agreed to in a state of drunkenness are voidable under the New Civil Code of the Philippines. Okay? So, under Article 1328 of the New Civil Code, it provides contracts entered into during a lucid interval are valid. Contracts agreed to in a state of drunkenness or during a hypnotic spell are voidable. Okay? However, they are valid until they are avoided. Okay? So, you must file a case in court to rescind the contract. Okay? Because it enjoys the presumption of validity. However, in law, if contracts are entered into during drunkenness, then it is voidable. The law penalizing manufacture of liquor without license is valid. If a person administers beverage to another which is injurious to the latter without intent to kill, he is punished for his wrongful act. Next, administering injurious substance or beverages. The penalties shall be applied in the respective cases to any person who, without intent to kill, shall inflict upon another any serious physical injury by knowingly administering to him any injurious substances or beverages, or by taking advantage of his weakness of mind and credulity. Okay? So the state may prevent some people from drinking highly spirited wine. The state may promulgate laws, okay, for regulation. They make laws which may prevent people of lower degree of civilization from drinking scientifically manufactured or highly spirited liquor. The reason is to promote peace and order, okay? The accused was prosecuted and convicted for violation of Act 1639, which prohibits any native of the Philippine Island who is a member of the non-Christian tribes to buy, receive, have in possession, or drink any intoxicating liquor other than the native wine or liquor which the tribe has been accustomed to take. So, in the Philippine setting, we can make laws in order to regulate wine production, okay, and consumption. In this case, Act 1639 prohibits a member of a certain tribe to drink liquors or other substances which are not native in their custom. Okay? Next, the accused attacks the legality of the law on the ground that it denies him of the equal protection of the law. Okay? So in this case, when a person was prevented to buy another alcoholic beverage, okay, because the law provides that he should only buy alcoholic beverage within his tribe. So he attacked that law, okay? So and then when he attacked that law, Supreme Court said that Act 1639 is valid. The use of non-Christian tribes is not based upon the accident or birth or parentage, but upon the degree of civilization. The members of the non-Christian tribes have a low degree of civilization. The purpose of the prohibition is to ensure peace and order in and among the people. Okay? It upheld the law. So, it has been experienced in the past that people of a lower degree of civilization taking scientifically distilled wine with a high percentage of alcohol resulted to lawlessness and crimes, thereby hampering the effort of the government to raise the standard of life and civilization. Okay? As enunciated in the case of People versus Kayat. Okay? Next, absorption and distribution of alcohol. So, in as much as alcohol, when ingested, does not require digestion, it is immediately absorbed in the walls of the stomach and duodenum. The maximum period of absorption occurs 30 to 60 minutes after the initial intake. The rate of absorption of alcohol in the stomach and intestine depends upon the following. First, concentration and total quantity of the alcohol taken. The higher the percentage of alcohol taken, the greater is the volume of alcohol per unit of time. So, the greater the volume of alcohol consumed will likewise enhance the absorption. Okay? Nature of the food in the stomach and intestine. Fatty food makes absorption slower as compared with sugar and other carbohydrates and protein. Okay? So, if you eat fatty foods, then the absorption of alcohol in the stomach is slower. And then volume of gastric content. The presence of sufficient amount of food and water in the stomach may delay the rate of absorption of alcohol. Next, disease condition of the stomach and intestine like achlorhydria, gastric atony, and chronic gastritis causes slower absorption. However, subtotal gastrectomy or gastroenterostomy may cause abnormally early intoxication because of its early evacuation of food to the duodenum where absorption is more rapid. Okay? The length of time the gastric content is held in the stomach prior to the opening of the pylorus and permeability of the stomach or intestinal wall. Warm drinks dilate gastric capillaries to cause more absorption. Okay? The optimum concentration of alcohol in beverage between 10 to 20% is the most rapidly absorbed. After absorption, alcohol is distributed throughout the body in proportion to the water contents. And then, parts of the body with more water content like blood, urine, brain, liver, kidney, and etc. have the highest concentration, while those with low water content like fat and bone have the lowest concentration. Okay, guys, these are just matters of reading, so please refer to your book, and if you have any questions, feel free to ask me. Now let's go to pharmacologic effects of alcohol. Okay, so ethyl alcohol depresses the central nervous system in descending order from the cerebral cortex to the medulla oblongata. It causes depression or temporary functional paralysis of the ganglionic cells. The more specialized the cells are, as in the cerebral cortex, the more sensitive they are to alcohol. A moderate dose will cause disturbance in the intellect and fine muscular movement. Bigger doses will involve depression on the ganglion cells, on the lower brain centers, in the basal ganglia, and brain stem, causing the person to stuporous and even comatose. Effects on the special senses, vision. The increasing amount of alcohol intake, the acuity is progressively diminished to the point where vision to obscure to a degree comparable to wearing dark sunglasses at night. Okay, so it disturbs your sight, your vision. Hearing. The increasing amount of alcohol intake diminishes the ability of the individual to perceive and appreciate varying intensities. Third, touch. The sense of touch is diminished with the increased amount of alcohol intake. So, the more you ingest alcohol, your sense of touch is affected. The blunting touch of sensation is responsible for frequent cigarette burns on the hand of chronic alcoholics. Next is taste. There is a decrease in the sense of taste. When a person is drunk, all food tastes good. Okay? That's why if we are drunk, we tend to eat more. Next is smell. The perception of smell is depressed by alcohol. Malodorous substances may be undetected by those under the influence of alcohol. Okay? Now, let's go to other effects of alcohol ingestion. First, dilatation of the blood vessels of the cutaneous surface. Second, increase in the pulse rate. Third, weaker cardiac systole, which tend to cause cardiac dilatation. And then, locally, it has direct irritation effect on the mucous membrane of the stomach and intestine. And then, slight depression of the liver functions as indicated by the decrease in hepatic oxygen consumption and decrease in glycogen storage. Okay? So, our liver is the organ that processes alcohol. Okay? More or less, a high degree of alcohol content goes to the liver. Okay? Next is fall of the blood pressure. Now, in this diagram, you can see the blood alcohol content in the bloodstream and then the clinical signs and symptoms. Okay? So, if 10 milligrams, there is pleasant clearing of the head. If it's 20 milligrams, physical feeling of well-being. And if it's 50 milligrams, the individual feels on top of the world and has the wisdom of Solomon and is very talkative. Okay? The sense of inhibition are gone. And then, sense the wisdom of Solomon and the talkativeness of Senator Claghorn. Okay? Increased self-confidence, decreased inhibitions, diminution of attentions, judgment, and control. If 100 milligrams alcohol content in the bloodstream, the individual is intoxicated and under the influence. Experts in the field believe that no innocent person would be convicted of being under the influence if he had a blood alcohol. If 150 milligrams, at this level, all individuals are intoxicated and deterioration in performance of acts of skill or judgment are present. Now, if the level of blood alcohol in the bloodstream is 150 to 300 milligrams percent, somewhere between these figures, all individuals lose some degree of muscular coordination, including the ability to walk properly and coordinate other body movements, disorientation, mental confusion, dizziness, sensory disturbances. This is decreased sense of pain, slurred speech, exaggerated emotional state, okay, like the state of grief, anger, and fear. Okay, so if the blood content of alcohol is 300 milligrams, at this level, most individuals becomes stuporous, incoordinated, and may even lose sphincter control. Okay, apathy or general inertia, decreased response to stimuli, impaired consciousness, sleep, or stupor. If 400 milligrams, this is the anesthetic level. Alcohol is not a good anesthetic because there is a narrow margin between anesthetic and the death level. Death from alcohol per se may occur at any level above 400 milligram. Okay? So if the blood content of alcohol is 400 milligrams and above, it could kill a person. Complete unconsciousness, coma, depressed or abolished reflexes, embarrassment of circulation and respiration, incontinence of urine and feces. Now, let's go to the symptomatic changes following ingestion of alcoholic beverages. Although human reaction varies from person to person, the clinical signs and symptoms following ingestion of alcohol may be divided into 3 stages. Okay? First, stage of excitement. This develops a few minutes after the initial dose of alcoholic drink has been absorbed and has reached the central nervous system. So, it is characterized by a feeling of well-being and slight excitation. The actions, speech, and emotion are less strained. Self-confidence develops, as well as blunting of self-criticism, self-consciousness, and self-control. Then, it is the manifestation during this state that makes the people entertain the erroneous belief that alcohol is a stimulant rather than a depressant. Alcohol does not stimulate the brain center, but rather inhibits the inhibition, causing it to act freely without constraint. Okay? Then, stage of incoordination or confusion. This is the stage 2. As the effects of alcohol become more pronounced, the nervous control of the body gradually diminishes. There is blunting of all the perceptive mechanism. Muscular coordination is lost. The irritating effect of alcohol, like nausea and vomiting, confusion, cardiac and respiratory symptoms, appear. Now, let's go to the degree of intoxication. Okay? First is slight inebriation. There is flushing of the face with exaggerate mood, but a person is able to control his behavior. He shows no signs of mental impairment, incoordination of movement, and difficulty of speech. Okay? Next degree is moderate inebriation. Person is talkative, argumentative, an overconfident person. There is slight impairment of mental faculties, difficulty of articulation, and loss of coordination to finer movement. The face is flushed with eyeballs congested. He is reckless and shows motor incoordination. He may be certified as being under the influence of alcohol. Okay? Next degree is the degree of being drunk. The mind is confused, behavior is irregular, and movement is uncontrolled. The speech is thick and uncoordinated. Behavior is uncontrollable. And then, very drunk or dead drunk. The mind is confused and disoriented. there is difficulty in speech and marked motor incoordination, and often walking is impossible. And then coma. The subject is stuporous or comatose. Sometimes it is difficult to differentiate this condition with others having coma. Now, let's go to the diagnostic points of drunkenness. Okay? So first, alcoholic smell of the breath or of the vomitus. And then dry furred tongue or with excessive salivation. And then irregular behavior, congestion of the conjunctiva, hesitancy or thickness of speech with impaired articulation, tremor or error of coordination and orientation. Examination of the blood and the urine shows the presence of alcohol. History of having taken alcohol beverages. Now, physical test to determine drunkenness. Okay? First is the Romberg's test. So, let the subject stand straight with heels together and with closed eyes for at least 1 minute. If he is not drunk, he will not sway to the front or to the sides. But if he is drunk, the body will not be stable in the absence of any existing disease. Okay? Now, let the subject stand straight with 1 foot ahead of the other so that the toes of 1 foot touch the heel of the other. This will remove the brace to prevent sideways. If drunk, there is more likelihood that the subject will sway sideways and fall. The test is repeated after the subject is free from the effect of alcohol and make a comparison of stability. Okay? Another exam, let the subject sit comfortably in a desk and get samples of his handwriting. Compare these writings with those taken when he is free from the effects of alcohol. Next is let the subject bend down and pick up a small object from the floor. If he stumbles, then his nervous system is not stable and that he may be drunk. And then, lastly, let the subject walk straight forward to a corner of a room and rapidly turn around without stopping. Tell him to walk back. You will notice that the subject may have uncertainty of steps, side steps, or he staggers while making the turn and in walking. Now, let's go to conditions simulating alcoholic intoxication. Okay? So, at this point, the person is not ingesting alcohol, but the body's reaction is like he is intoxicated. Okay? First condition is severe head injuries. Okay? And then metabolic disorders like hypoglycemia, diabetes precoma, uremia, hyperthyroidism, and etc. And then neurological conditions associated with dysarthria, ataxia, tremor, drowsiness, okay? Like disseminated sclerosis, intracranial tumors, Parkinson's disease, epilepsy, acute oral vertigo, and etc. And then, the effect of a drug is unlikely to be confused with the effect of alcohol unless the drug has been taken for the first time and has produced an unexpected reaction, or unless it has been in an unusually large dose. Okay? Because some drugs whose effects simulate alcohol intoxication are insulin and barbiturates and etc. Okay? So, most of the antihistamine group of drugs, morphine, the new analgesics which tend to cause giddiness, certain drugs used in the treatment of asthma, okay, like remedies containing atropine, and then drugs used in the treatment of involuntary movement like hyoscine, okay. So, all of these conditions simulate alcoholic intoxication, okay. So, if you are the medical legal officer, you should take note whether the origin is due to intoxication or due to underlying condition. Okay, other conditions that simulate intoxications are certain pre-existing psychological disorders like hypomania or general paresis, otherwise known as paralytic dementia. Okay? Another prodromata of cerebral vascular emergencies, which may show themselves as confusional states, amnesia, or aphasia. Okay? Another condition, high fever, which simulates intoxication. Next, exposure to carbon monoxide in sufficient concentration to give significant anoxemia on account of a number of conditions stimulating the conditions of intoxication. Okay? A physician must exercise due care and diligence in, if you are the medical legal officer or the doctor, you should take note of the following: the history taking, physical examination, and in the observation of the signs and symptom. Appropriate and available laboratory examination before the diagnosis of drunkenness is entertained. A patient became nauseated while driving his car and got out to vomit. A passing policeman arrested him for drunkenness. Okay, so here's a scenario. He went into a spasm in the cell and the defendant physician was called and saw the patient twice for 5 minutes each time. He advised the policeman that the man was drunk. The patient died a few hours. Now, let's go to the relationship between the blood alcohol level to the degree of intoxication. Okay? So, persons with blood alcohol level below 0.05% are not considered intoxicated. The majority of persons, 80 to 90%, with blood alcohol levels between 0.1% and 0.15% will have their faculties so impaired as to render them unfit to drive motor cars with reasonable safety. The majority of young people who are not habitual drinkers will be intoxicated to the extent of staggering when the blood level is about 0.15%. The majority of all persons, 80 to 90%, including habitual drinkers, will be intoxicated to the extent of staggering when the blood alcohol level is approximately 0.2%. Okay? The majority of persons will be in a coma when the blood alcohol level is approximately 0.5%. Okay? So, these discussions are just matter of readings. So, refer to your book. Okay? We are just talking about the overview. Okay? Of the alcohol levels in the bloodstream. Now, let's go to the factors responsible for the tolerance and susceptibility to alcohol. Okay? First, tolerance to alcohol. Two or more persons of the same age, sex, weight, and environmental upbringing may react differently to alcohol. One may be tolerant while others may be sensitive. Okay? Tolerance of a person to alcohol may be a result of two different factors, namely consumption tolerance. A person who has developed tolerance may have lesser percentage of blood alcohol as compared with another person who is not used to it when given the same quantity at the same time. The reason is that those habituated eliminate faster as compared with non-habitual drinkers. Okay? Next is constitutional tolerance. If a person habitually drinks alcoholic beverages, there develops a certain degree of adaptation by the body, thereby increasing the body's threshold to it. Later, greater quantity and percentage will be tolerated and will lead to diminution of its effect. Okay? So, your body adapts. If you consume alcohol habitually, then you will get drunk, okay, for a longer period of time due to exposure of alcohol for a long period of time also. Okay? Next is susceptibility to alcohol. The following factors render a subject unduly susceptible to the effects of alcohol. A. Exposure to extreme cold or fatigue. B. Pre-existing post-concussional state. C. Chronic cerebral vascular state like hypertension or advanced cerebral arteriosclerosis. D. Cerebral depression caused by drugs like barbiturates. E. Neurological disorders like disseminated sclerosis, intracranial tumor. F. Psychological disorders. Now, let's go to how alcohol influences the production of trauma. Alcohol enhances the production of trauma in the following ways. First, alcohol increases the irritability and decreases the sense of responsibility of a person, which in effect may cause him to become involved in quarrels or accidents. Second, if a person is under the influence of alcohol, the anesthetic effect of alcohol may obscure pain and other symptoms of injury so that serious trauma may be overlooked. Okay? For example, you are drunk and you cannot feel that you are hit or punched. Okay? So, when you get into a fight and then you wake up tomorrow, you will see a black eye. Okay? But you don't know what happened because you are drunk. Okay? Next, alcohol, being a depressant, renders the individual susceptible to the effects of traumatic shock or hemorrhage. Okay? The basic of the maxim that don't drive when drunk and don't drink when driving is that alcohol deteriorates the driving skill in the following ways. First, it decreases the reaction time. The driver becomes sluggish in his reaction in an impending danger. Then, it creates a false feeling of confidence. Then, it impairs concentration, dulls judgment, and degrades muscular coordination. And it decreases visual and auditory acuity. Okay? So, fate of alcohol. Consuming too much alcohol is linked to high blood pressure, irregular heartbeat, trouble pumping blood through the body, blood clots, stroke, cardiomyopathy or sagging, stretched heart muscle, or heart attack. Then, excessive alcohol use, both directly and through malnutrition, can also lead to anemia or decrease in your red blood cell. Okay? Next, alcohol is eliminated from the body by various metabolic mechanisms. The primary enzymes involved are aldehyde dehydrogenase, okay? And then alcohol dehydrogenase, then cytochrome, and catalinamine. From on there it is carried to the liver, where it is exposed to enzymes and then metabolized, okay? Alcohol is processed in the liver. It goes directly to the liver. That's why ingestion of alcohol is dangerous to the liver. Like all drugs, alcohol can damage your body, especially if you drink heavily every day or in binges. If you choose to drink alcohol, low-level drinking is better for you than heavy drinking or binge drinking. There is no level of safe alcohol consumption. Short-term influence. Short-term effects of alcohol includes hangover and alcohol poisoning, as well as falls and accidents. Conflict, lowered inhibitions, and risky behaviors. Okay? Lowered inhibitions leading to poor social judgment. Mood swings, reduced core body temperature, raised blood pressure, passing out of vomitus. And then long-term effect, loss of attention span, trouble learning, alcoholic hepatitis, liver fibrosis, steatosis or fatty liver, throat, mouth, larynx, breast, liver, colorectal or esophageal cancer, high blood pressure, cardiomyopathy, stroke, irregular heartbeat, and so on and so forth. Now, let's discuss the causes of death and postmortem findings of alcoholics. Acute alcoholic intoxication, paralysis of the medullary center. Alcohol depresses the nervous system by affecting the cerebral cortex, basal ganglia, cerebellum, and finally, the brainstem and medulla. B. Cardiac myopathy. The heart muscles may suffer direct damage from the high concentration of blood alcohol. Okay? It affects the heart. C. Ingestion of alcohol and synergistic drugs like barbiturates and tranquilizers may cause fatality. Okay? It is dangerous. Potentiation of alcohol by psychotropic drugs has been reported to have caused death. A blood level of 0.45% or greater is generally accepted as fatal level, although death has occurred at a level below 0.35%. Okay? Hidden trauma. Alcoholics are prone to be victims of traffic accidents or other traumatic injuries. Acute intoxication produces considerable analgesia and may deceptively conceal physical injuries. They may suffer from subdural hematoma, brain concussion, or abdominal injuries, which may be considered symptoms of drunkenness. Of course, if you are drunk, you are numb. You cannot feel anymore, okay? So, you will not know if what happened to you is due to blunt trauma or accidents. Okay? When you wake up in the morning, you will just find out that you have a black eye, a bruise, and so on and so forth. Because if you are drunk, your senses becomes numb. Okay? Third is unexpected aspiration of food, or otherwise known as cafe coronary syndrome. Okay? Aspiration of food into the respiratory passage may cause severe asphyxia. Okay? The sudden death in this case is characterized by the rapid onset of shortness of breath, choking on mealtime, or vomiting, and the presence of food particles on the respiratory system on post-mortem examination. Another is poisoning by congener or contaminants in alcoholic beverages. Okay? Alcoholic beverages may accidentally contain toxic substances which may cause injury or death of the drinker. There is a wide variety of impurities that may be found, but the following contaminants in bootleg liquors are quite common. Now, let's go to methyl alcohol, okay, or methanol, or wood alcohol. The mechanism of methanol poisoning is its conversion to formaldehyde and formic acid, which consequently causes acidosis. In the eye, it may cause blindness. The symptoms start as photophobia, followed by blurred vision to permanent blindness. This is due to the action of the poison on the ganglionic cells of the retina, with subsequent atrophy of the optic nerve. Okay? So, be careful, okay? Especially children, babies, they tend to drink or ingest alcohol. Okay? You must be careful because this can cause blindness. It can damage the optic nerve. Next is isopropyl alcohol or rubbing alcohol. The compound is converted in the body to acetone and excreted as such. Acetone is excreted through the lungs and produces hemorrhagic tracheobronchitis, bronchopneumonia, and hemorrhagic pulmonary edema. It also causes lower nephronephrosis, hemoglobinuria, fatty changes in the liver, respiratory paralysis, and eventually death. Next is ethylene glycol or diethylene glycol. Ethylene glycol is marked central nervous system depressant and is oxidized in the body to toxic oxalic acid. The oxalic acid crystals plug the excretory tubules of the kidneys, causing marked functional impairment and nephrosis. In the brain, it may cause chemical meningitis and meningoencephalitis. Diethylene glycol is also a central nervous depressant and causes central-lobular hydroptic degeneration and necrosis of the liver, as well as bilateral cortical necrosis. Okay? Please refer to your book for further discussion. Okay? Fifth, diseases associated with or as a complication of alcoholism. The most frequent effect of continuous consumption of alcohol is that the development of fatty liver may ultimately become a condition of liver cirrhosis. Okay? The liver cells are dying due to alcohol consumption. A cirrhotic liver may cause rupture of the esophageal varices. Alcoholism may also cause hemorrhagic pancreatitis, bronchopneumonia, and development of other infectious diseases. An alcoholic who is suddenly withdrawn from alcohol may suffer a state of excitement with hallucination known as delirium tremens. It is characterized by an attack of acute insanity with sleeplessness, marked tremors, excitement, fear, and sometimes with strong suicidal tendencies. Okay? So, if you are the physician, always take note if the person has withdrawal of alcohol because these symptoms might arise. Alcoholic polyneuritis may also develop as complication of alcoholism. There is a combined degeneration of the nerve fibers and myelin sheaths. Now, let's go to the postmortem findings in death due to alcoholism. Okay? As you can see in this diagram, the effects of alcohol on the body is detrimental. Okay? It can cause death. Okay? In the brain, it can cause brain damage. In the stomach, it can cause complications. In the liver, it can cause cirrhosis. In the pancreas, it can cause pancreatitis. In the intestine, it can cause intestinal complications. Okay? It can weaken the immune system. It can cause birth defects. It can cause lung infections. And it can also cause heart diseases. Okay? And so on and so forth. Okay, first, presence of alcoholic odor of the stomach contents. The odor emitted is not due to alcohol, but most often to that of the congener. Okay? Second, congestion of the mucosa of the stomach. Third, congestion of brain and its meninges. Fourth, heart may be dilated and flabby, and lungs congested and frothy. Otherwise, it is normal. Next, blood, alveolar air, and urine examinations reveal the presence of alcohol. Okay? So, these are the findings when you examine or when you perform autopsy. Okay? To a dead body who died maybe due to alcohol complication. Pathological drunkenness. A condition wherein a small amount of alcohol intake may be sufficient to make a person drunk on account of an existing pathological condition of the body. Brain concussion, sunstroke, epilepsy, and other conditions may be predispose a person to the effects of alcohol. Okay? Next, punch drunkenness. This is not a condition of drunkenness. It may be observed among professional boxers who may have developed a peculiar physical and mental condition on account of repeated trauma on the head. The individual simulates continuously a person who is drunk. Then lack of concentration, as in change the subject matter of a conversation abruptly and may ask the same questions for several times. A bad memory of recent events. Not too sociable, garrulous and boastful, but rather timid and shy. His articulation may be glazed and slurring. Okay? Next, Romberg sign may be positive and locomotion may be ataxic and unsteady. Next, involuntary movement of a toxic nature may be present. Now, let's go to the laboratory examination in alcoholism. Blood, urine, and respired air is tested in living person. To determine the presence of alcohol in the dead blood extracted from the heart, the urine taken directly from the urinary bladder may be used. Okay? The legal issue confronting physicians in the taking of specimens of blood, urine, and breath has been resolved in the decision of the U.S. Supreme Court in the case of Schmerber versus California. Okay? Where it was held that and came to conclude. Okay, and as enunciated in the case of Schmerber versus California, the Supreme Court of the U.S. declared that physician withdrawing blood from accused doesn't violate his constitutional right against self-incrimination because the act of withdrawing a blood is just a mere mechanical act. Okay, that's why it does not violate his right against self-incrimination. Second, the taking of a blood specimen by a physician in a simple medically acceptable manner of a hospital environment was not brutal and offensive. It is not a violation of any constitutional rights. Third, just because the lawyer of the accused said the accused can use his right against self-incrimination doesn't make the accused have any higher privilege. Fourth, the fluid specimen from the accused cannot be used for extra searches but for the purpose it was taking. The sample taken was after he was arrested lawfully. So under these circumstances, the withdrawal was reasonable as an incident to a lawful arrest. Okay? Like what I said before, it is a mere mechanical act. That's why it doesn't violate any constitutional right of the accused. Withdrawal of blood from a dead body cannot be a ground for civil damages. Okay? As enunciated in the case of Hazelwood versus Stoke, the husband died in an accident and was suspected of drink driving. The wife tried to sue the embalmer who withdrew blood of disturbance of the body. Court dismissed it because it didn't disfigure the body. The blood sample showed high alcohol and the others in accident were paid compensation from the estate. Now, let's go to the examination on how to determine presence of alcohol. Analysis of blood. It can be taken by physician, nurse, or any competent technician. It's widely accepted, but requesting a blood test for traffic violators is impractical. Next is analysis of the breath. The concentration of alcohol in the blood can be determined indirectly by making a quantitative determination of alcohol in the respired air. The basis of the analysis is that there is a constant ratio between the concentration of alcohol in the blood stream and in the alveolar air. Next is the analysis of the urine. Urine as a specimen for alcohol determination has not gained widespread use because of variability in the different periods of alcohol intake. Next, analysis of body tissue. This method is applicable in death cases. Examination of the brain for its alcohol content is a reliable diagnostic procedure. Other body organs like the liver, the spleen, kidney may also be examined for alcohol contents. And then analysis of saliva, perspiration, and spinal fluid. Although it may be done, examination of these fluids is seldom done. So, objective of alcohol examination. For screening, so this is done to determine whether alcohol is present in the sample. The sample may be blood, urine, saliva, vitreous humor, stomach content, or respired air or alveolar air. The instrument and the procedure must be simple for an ordinary layman or a police officer to perform the job. The apparatus must be portable so that the result will be available in the shortest possible time. The apparatus may be placed in a mobile laboratory for the purpose of screening drivers of motor vehicles. Next is for evidentiary purpose. If in the screening process, the sample had a positive result, the next procedure to be applied is the determination of the quantity of alcohol. The report is to be submitted in connection with such examination to be used as an evidence as to the presence and actual amount of alcohol in the submitted specimen. Okay, this is very important because this evidence can be used in the court trial. Okay, next, the procedure requires the use of precision instrument and should be performed in a regular chemical laboratory. Next, withdrawal of blood for alcohol determination, not giving evidence against the defendant. So, the withdrawal of blood from a person suspiciously drunk to determine the alcohol concentration in the bloodstream is not self-incriminatory. So, like I've said, it is a mechanical act. It does not violate any constitutional right of a person. So, the act is purely mechanical and it does not utilize the mental faculties of the subject. So, it can be done without any violation of existing laws. Okay, now here is a scenario which happened in Colorado and which was ruled by the Supreme Court of Colorado. Okay, the defendant, having been convicted of causing a death by driving an automobile while under the influence of intoxicating liquor, appealed to the Supreme Court of Colorado. The defendant contended on appeal that he was required to give evidence against himself by the admission of the result of a test of blood to determine the alcoholic content. Okay? The Supreme Court of Colorado declared that the original intent of the constitutional provision was to prevent the defendant being forced to give testimonial evidence against himself and did not contemplate the exclusion of evidence of physical facts relating to the defendant. So, in this case, what is protected under the Constitution is the compulsion to give evidence against yourself, okay? Testimonial evidence. However, in this case, what was taken was a blood sample, okay? There was no any testimonial evidence. That is why Supreme Court said it does not violate any existing rules. It is also not prohibited under the Constitution. Okay? The defendant is not deprived of any of his constitutional right by the admission of the testimony here in question. He is not compelled to testify against himself. Okay? Next is chemical test for intoxication admissible in evidence. So, any chemical test for alcohol to determine whether a person is under the influence of alcohol is admissible as evidence in court. The tendency of our modern court is to accept scientific methods in crime detection provided that it has gone beyond the experimental stage and has already been perfected. Okay? Now, another scenario or actual case which was pronounced by the Supreme Court of Oklahoma. So, the defendant was charged with the offense of driving his automobile when drunk and was found guilty by a jury in the trial court. He appealed to the Criminal Court of Appeals of Oklahoma. The defendant contended that the drunkometer and urine analysis test for the determination whether the defendant was under the influence of intoxicating liquor have not gained such scientific standing for infallibility as to justify admission of the expert testimony on it. However, Supreme Court of Oklahoma declared that The court is of the opinion that we should favor the adoption of scientific method for crime detection, where the demonstrated accuracy and reliability has become established and recognized. Justice is truth in action, and any instrumentality that aid justice in the ascertainment of truth should be embraced without delay. We believe that chemical tests of such body fluids as blood, urine, breath, spinal fluid gained that scientific recognition for infallibility as to be admissible in evidence. Okay? So, if the test conducted has already been recognized, already been practiced, then it can be admitted in court. It can be given weight. Okay? Like in this case. So, the standing rule with regards to chemical test for intoxication is that it is admissible in evidence. Like what we discussed before, any chemical test for alcohol to determine that person is under the influence of alcohol is admissible as evidence in court. Tendency of our modern court is to accept scientific method in crime detection because it provides that it's already gone beyond through the experimental stage and it's already perfected. Okay? Now, let's go to the societal reaction to the problem of alcoholism. So, due to alcoholism, society promulgated laws in order to regulate alcohol. Okay? Manufacturing of liquor only to a certain percentage of alcohol in beverages. Next, restricting the time and place of drinking and the availability of liquor to a particular age, sex, and other socio-economic group. Next, subjecting drivers at random to an alcohol screening test, and if found positive, it is to be followed by a quantitative determination of blood alcohol. If blood alcohol exceeds the maximum tolerable limit prescribed, the driver can be arrested. And then various indoctrination methods may be employed to encourage moderation or abstinence, like education in schools and churches. Another, an institutional organization approach introduces substitute form of tension relief into the social structure. Subsequent removal of the cause of tension and diverting attention to something else can also be looked into. Next, a variety of therapeutic approaches are taken under the concept that an alcoholic is a patient. Okay? So, therapy combines medicine with psychiatry, psychology, social casework, and Alcoholic Anonymous. And then pastoral counseling are given in churches. And then halfway houses are built to bridge the gap between the penal institution and the community. Okay, as you can see in this diagram, alcohol has a damaging effects on man. Okay, all the organs can be affected, and even the lifestyle of the person is affected. The holistic aspect of the person's life can be affected if that person is addicted to alcohol. Okay, the social aspect, the spiritual aspect, the physical aspect, the emotional aspect, and so on and so forth. Oh, now, that ends our discussion for this topic and for the course Legal Medicine. Okay? So, as you can observe, our lecture is mainly on the overview, okay, of the book of Pedro Solis. However, some discussions are taken from the internet because like I've said before, the book of Pedro Solis is an old book, so some of its discussions are outdated, so we need to update. However, our PowerPoint presentations are mainly overview, okay? Mostly definition of terms, enumerations, okay? So always refer to your book and then always research if you have if you want inputs, if you want to expand more on that topic. However, if you want to ask me, do not hesitate to message me, okay? I will answer your questions. I will research for you, okay? However, it is incumbent upon you students to study, to research, because you will be future doctors, okay? And if you become a medical legal officer, if you work in the government, the topics in legal medicine is very helpful, okay, in your practice, okay? So for non-medical students who are watching this video, you can always listen to the discussions, and if you also have questions, feel free to ask them in the comment section, okay? I will try to answer all of your questions. So thank you and God bless us all.